I'm back with Mr. Alfredo Hernandez, a patient of Dr. Michelle Khoo's. We have asked Dr. Khoo to join us in our conversations, and we are going to pick up where we left off in our last one, and that's when Mr. Hernandez got diagnosed with his genetic condition. I will let you guys take it from here.
So I think where we kind of left off earlier was I had just gotten the diagnosis that I had a hereditary mutation, a genetic mutation that was causing my condition to progress, a lamin mutation.
I can take over from here a little bit.
Sure.
Well, what Alfredo had, or what we found in him, is this mutation called lamin mutation. And this is one of the inherited conditions that causes cardiomyopathy or progressive cardiomyopathy that results in dilation and weakening of the heart muscle, and associated as well with progression of conduction disorders where the electrical system of the heart fails very quickly and prematurely, and then thereafter development of malignant heart rhythms such as ventricular tachycardia. When Alfredo first came to me, he was in congestive heart failure. And this was as a result of two factors. One, that he was in complete heart block and was being paced by the pacemaker all the time. And he was one of the minority of patients that developed dilation and weakening of his heart muscle from continued pacing in the right ventricle. Another contributing factor to his congestive heart failure was tachycardia-induced cardiomyopathy. This occurred because he was in atrial tachycardia, which is an abnormal fast heart rhythm involving the atrium. And this is a well-known manifestation also of lamin cardiomyopathy. And that was making the pacemaker pace his ventricles at the same rate as his atrium. So when he was fast for several weeks, his ventricles also weakened and he started going into congestive heart failure, where he started developing fluid accumulation throughout his body and his lungs, which then resulted in him feeling very uncomfortable with breathing difficulties as well as swelling of his legs and his abdomen. Alfredo's family has since been identified to have a large number of members that carry this mutation, and so the finding of this mutation in Alfredo and his siblings was very important in terms of identifying other members of families before they die. So I think this is one of the cases where it highlights the importance of knowing what you have, getting the proper diagnosis, and then being able to deal with the consequences of the diagnosis. And in this case, the consequences are quite significant.
So I was the first one in, I'd say, 4 generations, which is what I've been able to research and determine in my family to be diagnosed with this condition. But once I was diagnosed, I began to do some research in my family and started calling family members and started getting some information. But to date, about 50% of the family members that have been are positive, which is typical of this genetic mutation. It's an autosomal dominant mutation, which usually it's 50%. Obviously, it varies in generation. Like, it started with my grandfather. He was the one that carries this mutation. We were able to determine that because I found his death certificate, which said cause of death was cardiac syncope. And my grandmother lived to be well into her 90s, and she never had any heart problems. So it came from my grandfather's side of the family. And then in my mother's generation, I did the research, and it seems to be about 60% of them had pacemakers. And there were early mortalities, there were strokes, blood clots causing strokes, and a couple cases of sudden cardiac death. And then in my generation, which is going to be, all of my cousins, it's about, to date, about 50, 60% almost of the people that have been tested. So being that I was the first one to be diagnosed, I took on, with Dr. Khoo's guidance, took on the initiative to reach out to my family members and to communicate this to them, especially the ones that I knew had pacemakers, the ones that were having problems, to identify people and the importance of getting genetically tested. So as Dr. Khoo said earlier, it's important to get not just a diagnosis, but the genetic mutation and that diagnosis, because it allowed us to get a lot of our family members tested who had problems. And to date, we have made an impact and a change in a lot of my family members who are progressing in the same path, who would have had major complications if we had not intervened. And now we communicate with their physicians, the cardiologist out of state. I have conversations. It's interesting. Once I was sitting at home recovering from all of these conditions. I had nothing to do because I couldn't work. I was sick. I was in and out of the hospital. So I had this information and I needed to do something with it. So I did a lot of work in that, and I started getting calls from physicians in El Paso, in San Diego, in all over the country where my family members were, who wanted to know, what is this genetic mutation, because we don't know what it is and we've never heard of it. It's that rare. And that kind of segued into a lot of my family members getting tested and now getting the right procedure. To date, just this month alone, 2 of my family members went in and they got pacemaker revisions. They got in defibrillators.
Wow.
And they were tested positive. One good example of the significance of this is that one of my brothers, so he's my older brother, he was also became one of Dr. Khoo's patients because of my interactions with her. He began to develop similar patterns in progression of disease. He went to see her, and the day that he needed a pacemaker, she was going to implant the pacemaker. She got the results via fax of his genetic testing, and they were positive. So she was able to change her treatment plan to do the IV.
By the ICD.
Yes, with the ICD. And the significance of this is early intervention, the right device, the right medication, the defibrillator, from the initial onset of symptoms. He now has not had any complications. He has not had progression of disease of a substantial nature that's going to have him go into the same path that I went through. He's done really good, and his outcome's been really good.
He got really, really lucky because his genetic diagnosis came right when he was on the operating table and I was scrubbing my hands to put in a 2-wire pacemaker. And at that time, we did not know what was the genetic mutation that was affecting the family, right? So did he get lucky or what? Whereas if you look at Alfredo's path, he had initially an ablation, then he had a 2-wire pacemaker, he had a 3-wire pacemaker, and then we found his genetic diagnosis, which carries a high risk for sudden death. And that's where we had to convert his 3-wire pacemaker to a 3-wire defibrillator.
So that was a very important diagnosis, because when it deemed the need of the defibrillator because of my risks, knowing the genetic mutation. Sure enough, several months later, I went into ventricular fibrillation around 2:45 in the morning, and I did lose conscious for about 27 seconds, and my heart rate was well over 230 beats per minute.
So you could feel it when it was happening?
I could feel the initial onset. I got dizzy, but I just passed out.
Okay.
But if it had not been for that defibrillator, which did shock me, and I remember waking up, I was laying down on the bed. My wife was in panic. I was gone for about 27 seconds, and that defibrillator saved my life. The whole purpose of the diagnosis, the whole purpose for getting a defibrillator was that moment.
Wow.
So I was 43 years old.
Wow.
And if I had not had that defibrillator, I wouldn't be having this conversation with you today. So that was very intricate. It saved my life. My wife, it was at 2:45 in the morning. She wouldn't be giving me CPR at that time. There wouldn't have been enough time to have EMS come and resuscitate me, or maybe I would have been resuscitated and maybe sustained brain damage or had died without being able to be reversed. So that defibrillator saved my life. That was the important thing of that. And that was a strong point in recruiting a lot of the physicians in my family the importance of the defibrillator, because it happened to me and it's happened to other family members who are now no longer with us. We know now why they have died in the ages of, late 30s, early 50s of sudden cardiac death. Back then they didn't know what they were dealing with, but they were just calling it cardiac arrest of unknown origin. But so
then you get your pacemaker, then you get the defibrillator, you get shocked, and then what happens?
So, like Dr. Khoo said earlier, like with my brother, who we caught his condition early on, it prevented, it allowed her to slow down the progression of this disease. There's no cure. It's a symptomatic treatment. But in my condition, I had already developed a lot of scar tissue. I had already had cardiomyopathy. I had congestive heart failure. There was already a lot of damage sustained to my heart. So after I got the defibrillator, after I was shocked, I continued to get shocked several more times. I tried to go back into my life as normal as I could. I was playing racquetball again. It was a courageous move because I knew I had susceptibility for arrhythmias and ventricular fibrillation, but I needed to go back into my life. And I was in the racquetball, playing racquetball at the gym, and sure enough, I got shocked right there and then again in the middle of my game. And but after that, it saved my life multiple times, but my condition continued to progress, unfortunately. And I eventually started to develop a lot of scar tissue in the lower chambers of my heart, my right ventricle, and I was getting shocked a lot. And it was determined based on some electrophysiology studies that Dr. Khoo did soon after, that I had scar tissue not just on the inside of my heart, where they would do the ablations, but also on the outside of my heart. A lot of scar tissue. So I underwent a ventricular ablation inside of my ventricle with Dr. Khoo, and that did stabilize me. But she was able to determine at that moment that I had a lot of scar tissue and I needed a lot more ablations, not just on the inside now, but on the outside of my heart, which changes the whole picture of a simple ablation now to, external epicardial ablation. So Dr. Khoo had done several of those, and I trusted her as a physician to do mine. But she knew of a physician who was pretty well known in the country to have done hundreds out of San Francisco. She sent me to him. They medevaced me over there via medical jet, and I went to San Francisco in 2013. Where he was going to perform this procedure for me, and I was in surgery for about 14 hours. He did hundreds of ablations in my ventricle, inside my ventricle, outside of my ventricle, lots of scar tissue. That did help a lot, but he was also able to determine during this procedure, because they do studies where they go in and see where the hot spots are at, they see where the abnormal circuitry is at, and he was able to determine that I did have I had abnormal circuitry, but it was really close to an artery in my heart that could not be ablated. And then I have also abnormal circuitry inside my heart muscle that could also not be ablated, because if you ablate these regions, it could cause a lot more problems or even death.